Hello, everybody. I'm Chris Bird. It's morning in New England, and I'm here with Matt Dallahan. How you doing this morning, Matt?
I'm doing great, Chris. Hanging in there. How about you?
I'm doing well. Usually this time of the morning, we'd probably be in the office, feet up, talking about ideas, talking about what's going on in the market, but it's a little bit different for all of us these days. This is our opportunity to give you the recap of last week, primarily what happened on Capitol Hill, what happened in the regulatory agencies, follow up on the webinar that we had last week, and address some questions that seem to be recurring from a lot of our partners and their employer clients, and give you the best answers that we can at this time.
Yeah, this is really the first in a series of videos that you'll see from us, kind of our SpeedLift videos that we're starting to really try to get the word out as quickly as we possibly can as new updates happen out in the marketplace, new solutions and opportunities to help employers and employees that maybe we're hearing about. And so we're using video to try to keep it a little bit light and get the information out as quickly as we possibly can.
So I'm going to start by talking about the two major considerations in the bill that passed on Friday and was signed into law late Friday by the president. And the first is telemedicine. So there's a temporary provision in the bill that provides that first dollar coverage by a health insurance plan for telemedicine services is HSA compatible. And the important thing is this pertains to any telemedicine services, whether they are to treat COVID or not. It is, however, time limited, so it is a temporary provision. It applies to plan years beginning on or before December 31st, 2021, next year. And so this coverage could extend theoretically into 2022 in some plans that aren't calendar year plans. The second is a change to the over-the-counter restrictions that were put in place with the Affordable Care Act in 2013. Two things happened last week. The first is that over-the-counter drugs and medicines are now reimbursable tax-free without a prescription. Remember that before 2013, that was the law. In 2013, the law changed that said over-the-counter drugs and medicines like Tylenol and cold medicines are reimbursable tax-free only if they have a prescription. And so all this does is it removes the prescription limitation and makes the reimbursement tax-free unconditional. The second point that was driven home last week in the legislation was the fact that menstrual care products are now reimbursable as a qualified over-the-counter product or as a category of over-the-counter products tax-free. One thing to keep in mind based on a couple of conversations that I've had is that this change doesn't have any effect at all on what you call dual-purpose items. Items that have always required and will continue to require a documentation of medical necessity. Think of something like an allergy pillow. Okay, in some cases that could be reimbursable. In some cases it's not, but only if you have a certificate of medical necessity from a healthcare provider. So there are some specific considerations around the operational rollout of this change, particularly on the debit card. And Matt, I'm going to pass it to you to talk about that.
Sure. Yeah. Thanks, Chris. So as Chris mentioned, this change applies for expenses incurred as of 1/1/2020 or after. And so certainly consumers could start to submit manual claims, at any time. I think the good news is our standard plan templates within WEX Health Cloud already support coverage of OTCs. And so if you start to see manual claims volume coming in, you should be well prepared to do that. From a debit card perspective, really the biggest change is we need a new updated eligible items list to be deployed out to the market by CGIS. And so CGIS is fast at work at this, working closely with their partners to make this happen. The Eligible Items List Committee, believe it or not, that is a real committee, has gotten together and is starting to work on that list. And we're anticipating that as of April 15th, that list will start being deployed out to merchants. From there, it will really be at their discretion in terms of when the merchants apply that new list in their point of sale systems. But certainly, given the magnitude of the change, we think that the merchant community is going to act quickly. Realistically, I'd say we'd expect that change to happen within the next 4 to 6 weeks. So that really is the big ticket item that we need to take place there. as far as getting debit cards up and working. And again, if the card today supports things like saline solution and over the counters that we're still in after the change, there's nothing that needs to happen. The cards will just start to work as soon as that new list gets out into the market. So one of the other changes that we saw come about last week was the extension of tax filing kind of across the board, at least at a federal level. And with that, the extension of the HSA contribution deadline to July 15th. So that gives everybody a little bit more time to get their taxes in, and certainly for consumers who are looking to do a post-tax contribution, gives them time to make that happen. 5498 is still at its traditional deadline of May 31st, but we are awaiting this, other guidance to see if that is going to change in conjunction with that. Chris, any changes around FSAs maybe that we need to highlight?
Sure. We've gotten a whole lot of questions about FSAs, and I want to highlight 4 of them right here. The first one's an easy one. We have actually gotten the question, can an employer extend the claims filing deadline or the run-out period for claims? So many calendar year claims or many calendar year plans allow the participants to file claims for the prior year's expenses into the first 90 days, for example, of the next year, so up to March 31st. The good news is that there's nothing that has to happen from a regulatory perspective to make this change. This is completely at the discretion of the employer. In fact, at WEX yesterday, we just announced that we were extending our claims filing deadline to May 31st, and we're hearing a lot of such activity in the employer community. It's simply a change in plan documents, and that can be done very simply. The second category, there are 3 questions that are really related to the constraints on access to healthcare services that a participant is experiencing right now, as dentists and vision care specialists and even a lot of doctors are either shutting down or not seeing as many patients. And this raises the risk that a participant could lose money in their plan, particularly if they were saving for something and now they can't have that medical service. And so the 3 questions are, the first is, will the grace period be lengthened? Will the 75-day or 2.5-month grace period be lengthened? The second is kind of related to that, is for carryover plans. Will the carryover limit be increased from $500 to something bigger, at least temporarily? Again, think of somebody who has, let's say, a July 1st to June 30th plan right now. They may be sweating losing money because they had an appointment scheduled in April or May, and now they're thinking that appointment is not going to happen, and I'm not going to be able to incur that expense. I'm going to leave a bunch of money in the plan, right? And the third is kind of roughly related to that as well, as can participants change their elections? Is this a special enough set of circumstances that it's a qualifying event and a participant could say, okay, I want to ratchet back my elections because I don't think I'm going to be able to get to the dentist or the doctor or the eye doctor, right? The IRS has been asked all of these questions, and they have acknowledged them, and they've written back to industry, and they've said, hey, we got your questions. We don't need anything else for you. We're going to consider all of these and the many other questions that we're getting. And I've talked to people who worked in the Treasury during 9/11 and the 2008 financial crisis, and they said, it's a real challenge to be working for somebody like the IRS right now because they are literally inundated with a host of questions from all over the place. And so we know that they've got the questions. We know that they've acknowledged the receipt, and they've said they will consider them. When they're going to act on them and what that action may be is something we're just going to have to wait and see on. So Matt, I'm going to ask you to talk a little bit about some of the SpeedLift products and a big question that we've been getting around that.
Sure. Yeah, I think those of you who attended the webinar, first of all, thank you for being on last week. It was a lot of fun to see familiar names and virtual faces on that webinar. One of the questions that we've been getting from folks is around Section 139, and really for those who aren't as familiar with that, there is a potential for some of these programs to qualify for tax-free treatment under Section 139, which really relates to declarations of disasters and emergencies. And so we've been doing some research and feel pretty good about the applicability of that to some of the programs. But I think really the most important thing is, as you're working with employers and coming up with some of these ways to provide relief to employees, really would encourage you to consult tax counsel and ensure that you're getting good advice and that you're on solid ground as you think about that. There are some nuances there around wage replacement that you need to be cognizant of, and so I think it's always wise to get tax counsel engaged on some of these programs. Chris, one of the other things that we're hearing about is some developments around COBRA, and I don't know if you've had the opportunity to think about that much or talk with any partners around what they're seeing there.
Sure. If you look at the statistics as they come out from the government, you probably read last week that during the period 2 weeks ago, the statistic was reported last week that initial jobless claims increased from their normal level of about 300,000 a week to 3.3 million. And that's a huge spike. That's not surprising given what we all know has been going on with the economy, whole sectors of the economy essentially going, into deep freeze and a lot of people losing their jobs as a result of that. We are watching very carefully for the next set of statistics. They'll come out on Thursday. The consensus economists forecast is that we're going to see something very similar to what we saw last week, another 3.5 million. We'll wait and see whether or not that's right. But clearly, one way or another, there's a surge in initial jobless claims. And to the extent that those people are COBRA eligible, I'm going to talk about that in a minute, that obviously is going to create a tsunami of notices going out and calls coming into the call center for people to try to navigate, what do I want to do and how do I do it? We are already hearing anecdotal evidence from some of our partners that they are seeing an increase in activity. I think for all of us who are in the COBRA business, what you want to do is you want to monitor a couple of things. Look at those Bureau of Labor statistics, leading indicators, look at the unemployment rate, but also look at your own activity and see how many notices you're actually sending out, because obviously that's your own leading indicator. Here are some factors that will play in. Do we think that you're going to get 10 times as much business? Probably not. There are a number of companies, particularly larger companies, who are laying people off through furloughs, and they are, at least initially, those furloughs, many of those companies are offering to continue health benefits because they feel that that's the way that they keep the hook into those employees because they want them back when this downturn ends. And so keeping them on the health plan is a good way to keep them engaged and get them back, hopefully, when things turn back up. The other is employer size. So to the extent that more of the unemployment comes from smaller employers, many of those employers may not provide group health today. And so that may not lead to a COBRA event. And then there will be outright business failures. So unfortunate as it is, we know that's going to be the case. And if a business fails, their group health plan likely goes away, and therefore COBRA becomes kind of a moot point. And so we believe that there's going to be a surge in COBRA activity. We don't think it's going to be 10x. Nobody knows what it's going to be, but it's something that we should all prepare for in the industry and watch that as it goes forward. So that's the information that we wanted to cover for you today. And I want to thank you for tuning in. Matt, it's been a pleasure working with you, as always. And as Matt said at the top, this is the first of a weekly series that you'll be seeing. We will try to be fresh and relevant with our content. Things are going to change, obviously. We'll be talking about a variety of different subjects. But if you have particular issues or areas that you would like to see addressed, please reach out to your account executive. They'll make sure that those questions and those suggestions get back to us. So thank you again for tuning in, and have a good day.